So welcome to, well, goodness, our very first workshop with Origin Rehab. This workshop is called Stand Tall, and it's aimed at helping seniors and their caregivers prevent falls, and also stay active and healthy for a lifetime. Let me tell you a little bit about who we are. My name is David Reed. I am a physical therapist, and I've been a physical therapist for 15 years. I've been David Reed for almost 40 years. My focus professionally has always been on geriatrics and on community health. It's what I've really loved and where I've gravitated toward over these last 15 years. It's just kind of where my passion has led me and what I really enjoy. But at home I have three kids, all boys. Charlie is the oldest, Jack and Joshua is the youngest. We have two dogs, Millie and Milo. You can see them down here. Millie is the lab and Milo is our pug. And we have, and then I have one amazing wife who holds it all together. And who's really the reason that I'm here and able to do all this tonight. Origin Rehab, however, was founded just last year. It's a mobile physical therapy and wellness service taking care of the Charlotte and Metro Charlotte areas. The mission of Origin Rehab is to improve the health of our community, one client at a time. All of our care is one-on-one. And we do this by truly listening to our clients and providing care when, where, and how it's most valuable to that individual. In short, we help adults become active and stay mobile, strong, and healthy to live a life they love with the people they love. So a little bit about what we're going to do this evening. The scope, what we're going to talk about is really the problem of falls in the United States and a lot about why we're here. A few things to keep in mind. We may talk about things throughout the evening. If you have any questions, please feel free to drop the question in the chat box. Don't wait till the end. I promise you, it happens to me all the time. You'll forget what your question is, and it's important. I want to make sure that you get all of the answers that you came here for this evening. So along that line, I'm happy to stay as late, and we can keep this going as long as you'd like. We have the time definitely set aside. Beyond just talking about falls, we're going to talk about some of the conditions that lead to a fall. Not just the problem and a whole bunch of information for you, but we're going to talk about the actual conditions that lead up to a fall. What contributes? What are the building blocks, if you will? And then a plan. Understanding what something is without a plan, what a problem is without a plan to solve it, isn't very useful for you, and it's not a great way to spend your time this evening. So we're going to talk about the future of falls treatment, where we think it is, and I'll even give you some real results, some things that we've observed directly and been able to measure and become pretty involved with over the last several years. First of all, again, you can go ahead and feel free to answer in the chat box. Here's the first quiz question. So considering age alone, not talking about medical history or the use of any canes or walkers, how many adults 65 and older, again, no other factors, will fall this year? Go ahead and drop it in the chat box here if you will. Just A, B, C, or D. Okay. Looks like the consensus is B. That's right, 1 in 4. Just by being age 65, 1 in 4 people are going to fall any given year. Second quiz question is just like the first, but adults 80 and over. Just by being age 80 and over, how many adults will fall in a given year? A, everyone. B, 1 in 3, 1 in 5, or 1 in 7? Alrighty. And so the answer here is going to be B, 1 in 3. So 1 in 4 adults 65 and older, 1 in 3 adults 85 and older with no other risk factors will fall in a given year. It's just a staggering number to me. So let's get a little bit deeper into the scope of the problem. Falls, and that's why I chose this picture, because there's falls. Falls are a big and growing problem, and it's really why we're here, what we're here to talk about tonight. We just talked about 1 in 4 folks over the age of 65 and 1 in 3 over the age of 80 will fall in a given year. But did you know that there will be over 3 million ED visits and over 800,000 hospital admissions just due to falls in a given year? Combine that, understanding that 95% of hip fractures are caused by falls, and hip fractures will contribute to over 300,000 hospital admissions. All of this is annual numbers. Women experience a disproportionately large number of hip fractures. 3 out of every 4 hip fractures happens to a woman. The cost of falls is pretty staggering too. Cost for non-fatal falls, and this is data from just a few years back, and it's expected to increase, but the cost for non-fatal falls in the United States alone was $50 billion. $29 billion of that was attributed to Medicare. $12 billion went to private or out-of-pocket costs, and $9 billion was paid by Medicaid. So it's just an expensive problem. Over the approximate 9 years between 2007 and 2016, there was a 30% increase in deaths related to falls. And that's an average of 3.33% every single year. So the falls are becoming apparently more serious as time goes on. And of course, all of this was pre-COVID. And so the effect of COVID, what we're seeing is it's having a disproportionate effect on our older adult population. There's less activity that's permitted, and with less activity comes a greater amount of atrophy or weakness that happens just as a byproduct of being less active. So folks aren't able to maintain the strength that they have, and what this leads to is more falls. And we'll dive into some of that in just a little bit here. So that's the scope of the problem. And now we're going to talk a little bit about what leads to a fall. So the building blocks of a fall. Understanding what leads to a fall gives us a pathway to understand what the solution to the problem of falls is. And so this is what I like to call the pathway. This is what we call the pathway here with Origin Rehab. So falls happen here under the events heading. And what you can see is this is way downstream from everything else. So that's where falls happen. And there's so many things that happen, prior to a fall. Under the first heading, all the way upstream, things that influence a person's medical conditions, their medical history, their social history, how much they interact with one another. And that's been pretty disproportionately affected here in the last year as well. And a person's environment. Add on to that how a person behaves in their environment, what they eat, how they fuel their body, the exercise that they get, some of the habits that they have or maybe don't have. All of these things contribute to risk. Does a person have an intolerance to movement or exercise? Do they have certain diet intolerances? Does this predispose them to restless sleep? As we build, these things will show themselves in what we call signs, weight symptoms, changes in lab values, so your blood work that you get when you go to the doctor, and even physical changes that we see as some of the weight gain and things like that, which build into symptoms, a feeling of sleepiness or restlessness, pain symptoms, or just not really engaging well in conversations, poor eye contact, just being a little bit dazed. And all of these things have always been there, and we've known about these things and measured them relatively independently at times, but knowing about these things before a fall happened has been the key, and it's been the key right under our noses the entire time here. But we tend to manage falls once they happen, and it's really the most expensive way to do it. As you saw in the last slide, it's a $50 billion a year problem. So this results in direct costs, not only to insurance companies, but to you as the person who may potentially be falling as well. So medical costs, pharmacy costs, and then just kind of downtime costs in terms of pain, in terms of having to gather and get the help that you need at home. These are all really important things, and things that that we hadn't even considered until a fall happened oftentimes. But what if we took our management of the problem of falls from managing them once they happened in the events column upstream? What if we started managing some of the influences, some of the behaviors, some of the risk, or some of the signs that we know and we've seen and known about all the time, well beforehand? What would that look like? Before we get there, let's go to the third question that I have for you today. What is the number one predictor of falls? We have A, fear of falling; B, a recent enrollment in a unicycling class; C, not wearing shoes; or D, a previous fall. Which is the number one thing that predicts falls? That's right. If you answered D, you are correct. A history of falls is the number one predictor of falling. And so from here, we'll get into a little bit more about the plan. We'll talk about what we can do right now to help reduce falls and live an active life. And this is, after all, the meat and potatoes of why you're here. You know that falls are a problem. You now know a little bit more about them being a problem for so many older adults around the United States. But what can we really do about it? That's an important question to ask, and I hope to be able to answer that for you here this evening. To really answer that question, we need to understand three things. We call them the essentials. We need to understand the past, present, and future. Understanding the past, being aware of the present conditions, and anticipating future abilities. And we'll go through those now. First, when I have a new person, a new client in front of me, one of the things that we're doing first, right off the bat, is getting a great understanding of their history. We want to know where they've been, and knowing where someone has been helps us to know where we're going. It gives us a trajectory line. Understanding, especially things about a person's possibly having things like depression or anxiety, struggling with issues, having to do with pain or other things that you might be medicated for. All these different medications have an effect on the body. And I'm not saying that you should or shouldn't take them. That's between you and your medical provider. But what we do know is some of these medications, depending on what they're for and what class they're in, if they're having an effect on the brain, they'll also often contribute to an increased fall risk. It's not that you should stop taking them at all. Don't mishear me. But what we should do is understand what risks they prevent and start to put in safeguards around those things. So it's really an understanding component that we need to be, an understanding and awareness of what's going into our bodies and what's contributing to the falls. The other thing I'll do, besides taking a thorough history, we're going to really look with our eyes. So we're going to watch how somebody walks or stands up, watch how they perform tasks around the house. I'll listen to them describe the help that they need for things like dressing or bathing or just doing the day-to-day tasks that they have to do on a daily basis. The words that folks use give excellent clues as to exactly what's going on and the help that they need, and a lot of the impairment that's going on with that individual. And third, when I'm looking at the individual, I'll ask questions just to make sure that I'm seeing and hearing the right things. I want to make sure that I clarify those things. So if I'm seeing things right, or if I'm hearing you properly, and then restating things so that I really understand how things are affecting that individual at that time. And talking about things also, like personal habits, smoking or nutrition, is the person the person that I'm speaking with, are you fueling your body and your activities properly? These are very important things to consider. Along with observation, not only the person in front of me, but the environment that person lives in as well. And this is a really big reason why Origin Rehab is set up to do mobile therapy. I believe that the most functional environment that a person can receive treatment in is their home, because it's where they spend a lot of time. And over the last year, it's even more true. We're home even more often. So, bringing the clinic to you is the whole concept. So that you can practice getting better, having better balance in your home, in the most functional environment possible. So that's really a big reason, a big part of why we set things up the way that we did when starting this organization. So looking specifically at your home, what we're looking for are things like narrow walkways. Is it easy to bump into a wall or trip over something as you're walking between two objects? Looking at things like throw rugs. If you're not lifting your foot up properly and completely, taking that next step, it's really easy to drag it and have that rug curl up on you. It happens just about every time I go to a gas station, especially in the winter when it's raining. Almost always trip on those rugs and fix them afterwards. Coffee tables with sharp corners. So should you trip and should you fall, you want to make sure that as you're falling, you're not going to cut your head or cause any serious bleeding type problems. And then we'll look at other things. So planning for the nighttime. Are walkways lit well? Is there a night light that comes on at night automatically, so that when you have to use the restroom in the middle of the night, you're not walking down an unlit hallway rushing to the bathroom? We'll also look closely at the bathroom itself. A lot of falls, disproportionate number of falls happen in the bathroom. So we'll look at the bathtub or the shower, the clearance, the amount that you have to step over to get into the bathtub or the shower. And then bath mats, what type? Are they the really sticky, grippy kind, or are we just kind of throwing a towel on the floor that kind of slips and slides a little bit more? So looking at things like that, grab bars, just different things that could help and give you a little bit more security in the bathroom. Not that you necessarily need it, it's just what is there to work with. Here are the big six. Now these items, these next few items that we're going to talk about, are probably some of the most important things that we consider when looking at somebody's fall risk. These individual items, just like we talked about before with age being a factor, these individual things by themselves increase a person's fall risk. So first, we talked about the number one predictor of falls being a previous fall. Well, that's the number one item on this list. If an individual has had any falls in the last year, we check the box. It's not a good thing or a bad thing. It's just something to know. And the more of these boxes, the more of these items that we're checking off of this list, again, they compound the risk for falls in a given year. So having had any falls in the last year, if somebody worries about falling or has a fear of falling, sometimes we can see this as somebody holding onto furniture as they walk through the house, or just really gripping tightly and walking slowly, or I guess most of the time it's really holding on tightly to furniture and getting a little bit nervous, especially when they have to walk across a room and there's no furniture to grab onto. And again, feeling unsteady while you're standing or walking. also manifests itself that way as well. So asking both of these questions, but both of them independently, increase somebody's risk for falling. Using an assistive device like a cane or a walker, acknowledging that you're uncomfortable with balance in some way, that you need to use a cane or a walker, just kind of gives a clue that a fall is a little bit more risky. Having been hospitalized in the last 3 months, and again, over the last year with COVID and many folks having contracted the coronavirus, folks have spent more time in hospitals. And the nature and course of this disease has its effect on the lungs, which has an effect on somebody's ability to breathe and to tolerate activity, things like that. And so, again, recall from before, reduced activity is going to lead to more atrophy, which is going to lead to more falls. It's a part of that cycle. And then finally, using any kind of medication that acts on the brain. So for things like depression or anxiety, sometimes for medications that artificially lower blood pressure. They can cause different conditions that make falling a little bit more likely, becoming a little bit dizzy, a little bit more likely. So it's good to pay attention to those things and know that they're there. These are the big 6 factors. So all of that is knowing the past. Now that we have a good picture of where an individual was as sort of like the base of the pyramid or the foundation of your house, we have a good jumping off point to understand what the person's individual present abilities are. And so that's where some testing and measurements come in. So a couple of tests that I use to actually put numbers to a person's balance are the timed up and go test. And before we move on, I'll tell you, I put some of these things here. It kind of clutters up the page a little bit, but understanding that some of these other tests, like the Berg balance test or the 2-minute walk test, they take a little bit longer to administer than this test, where a person stands, walks about 10 feet, turns around, comes back, and then sits down in the same chair that they started from. Often takes about 10 to 15 seconds. The Berg test takes about 25 minutes to 30 minutes if it's administered properly, and the 2-minute walk test takes at least 2 minutes, not including setting up or resting afterwards to administer properly. Now, the relationship that this test has with these other two and the other ones that I'll show you, it's excellent. So this test is a really good predictor of how somebody's going to do on these other two. So it's really why I use these ones initially. It gives me a great idea of where a person stands, what a person's balance is like, before going too deep, too far down the rabbit hole. It also allows me to do more tests. So a person doesn't become so fatigued that we only get one perspective of balance on the initial visit. So the next test I like to do is 5 times sit to stand, which is exactly that. A person standing up and sitting down 5 times. And we time how long it takes them to do that. A longer time to complete 5 times standing up and sitting down tells me that there's less dynamic strength and or a greater fatigability of the muscles, which tells me that that path walking across the living room without any kind of assistive device or furniture to hang on to might be a little bit more dangerous. If you get fatigued or winded in the middle, you're kind of on an island and there's not a lot to hold on to. If you're rushing to the bathroom at night and you get tired on the way there, well, you have to complete your business and then walk all the way back. That can be, it may sound silly, but that can be very fatiguing to somebody, especially after they've been out of the hospital just recently for things like COVID. And lastly, I'll do the functional reach test, which is standing with a person's arm flexed to about 90 degrees and then just bending forward at the waist and seeing how far a person can reach before they start to feel like they're losing their balance. And we'll measure that distance from the tips of your fingers at start to the tips of your fingers at the end of the test. And all of these things, all of these tests, these 3 tests can be done inside of about 10 minutes, even with rest in between them. So it gives us a really great picture of dynamic balance, dynamic strength, and static balance. And it's really correlated well with several other tests that have been, really deeply researched and published on, so that I feel like we have a really good idea of where we stand at the present, and that's really where we wanted to be. So we can check off that middle box. Finally, we want to anticipate future abilities. And so what we're going to do is we're going to influence or manage what we call the big five. The big five things that we can actually touch and adjust in our own lives to make falling a little bit less likely. So first is our environment. We talked a little bit about throw rugs or narrow walkways or things like that. We just want to make sure that we're walking through our environment and kind of putting on our, kind of danger goggles, right? We want to make sure that we remove any obstacles that could possibly result in tripping. If you're going to get tired and your muscles are just going to give out, that's one thing. But we want to make sure not to help falls along and give anything that could cause tripping an advantage. Things like throw rugs, especially the kind that don't lie flat against the ground, that are a little bit more puffy, and that are easy to kind of, if you drag your foot, they're going to sort of curl up on you. Second thing, and something that not a lot of folks think about, is our social environment. Now, again, COVID has really limited the ability that we have to socialize with our friends and our family. But as much as we can, it's important to find creative ways to be able to socialize and interact with other people. People are social creatures. We're meant to interact with one another. And when we don't get that, we tend to be much less active. And it kind of goes back to that cycle that we talked about previously, where less activity leads to atrophy, which leads to more falls. And it just goes on and on from there. So, I'd advocate using things like, meetings like this. If you don't feel comfortable meeting in person, talking, through the window, I've heard folks frequently doing, or even just going back really old school, sitting on the front porch and talking across the street to your neighbors. Anything that we can do to interact with another human being, to have a conversation, it's really important to do. We've mentioned it a few times now, but fueling well. Making sure that we're eating the right things to allow our bodies to prepare and repair and get as strong as we possibly can. Ensuring that meals are healthy and nutritious, making sure that we have vegetables and fruits and good lean meats, and even some good potatoes or breads, something to kind of fuel those things. But everything in balance, right? If you need to, and if speaking with your doctor or your dietitian, using supplements and vitamins can be a really good thing as well. There's some really interesting studies about supplementing with vitamin D and how that has actually, just doing that has reduced falls and fall risk just in itself, especially injury after fall risk. Exercise, making sure to schedule in time for regular movement. And movement that's just not just standing up and doing chores or things like that, but movement for movement's sake. Taking the dog for a walk or just going out for a walk on your own. Scheduling regular exercise and encouraging just daily activity is very, very important to maintaining the strength that you do have. And finally, looking at behaviors that could take away from your physical abilities or the physical possibilities. Looking at resources that can help you stop things like smoking. Smoking prevents oxygen from getting to your brain, which kind of gives it its effect. It also prevents oxygen from getting to your blood or through your blood to your muscles to make them as effective as they possibly can be. So looking at different behaviors like smoking or like drinking to excess, things that are just unhealthy and will lead to less physical activity in the long run are very important, especially if you have a high risk for falling. Getting closer to the end here, we'll talk a little bit about the cost of healthcare. It's really important. Looking just at folks 55 and older, we split this chart into six different categories by age, but we'll look only at the 55 to 64 group, the 65 to 74 group, and then the 75 and older group. And then if we look at just moving from high risk to medium risk, or from medium risk to low risk, right? So from yellow to orange, or orange to blue. Folks that fall into the high fall risk category, the medium fall risk category, the low fall risk category. This is their the annual cost of their healthcare plotted out. So if we look at only moving just one risk category, what we can see is about an average of about $7,500 per person in reduced medical charges for each age category and risk group in a given year. So every single year, saving about $7,500 in charges. So if we talked about the $50 billion in non-fatal falls the $50 billion that was billed only attributable to non-fatal falls in a given year, reducing your risk from high to medium, or from medium to low, for each person that we do that for, reduces that 50 billion by about 7,500. And it may seem like a drop in a bucket, and maybe it is, but if we can do that for our community, we make our community that much healthier, and require that many fewer resources. But what it also means is not just the dollars and cents. It also means fewer people actually falling, fewer people being in pain and needing those healthcare resources that they have to access because they've injured themselves or done something that is damaging to the body and requiring medical attention after just having sustained a fall. So these things are important, really, in a number, looking at them a number of different ways. Again, not just dollars and cents, but to the actual real people who are involved. And so, that's how we look at where things move into the future. And that's great, right? We can understand what the research says. We can understand what the numbers that we've pulled from cost data says, but how has this impacted real people? How has it impacted real families and real lives? That's really the most important question that we can ask tonight. And it's really where we founded this company, Origin Rehab. Again, like I told you in the beginning, to help improve the health and well-being of our community, really focused on seniors and their caregivers. Those are real lives, real families, and real people that we're affecting. So what effect have we had? We've noticed a 28.5% reduction in risk of falls. So we've been able to reduce folks' risk by about by over 25%, just in risk. Actual falls, well, we've observed over a 21% reduction in actual real falls. But probably most impressively and most importantly to me is the about 45% reduction in hospitalizations that resulted from falls, measured against previous years' rates. What this means is that folks who've fallen fell less seriously, required less medical attention. So we were actually successful in taking them from high to medium risk, or from medium risk to lower risk. And what that means is fewer hospitalizations, not only less cost, but less pain, less need for that medical care. And because there's less need, again, that means fewer people that are in actual real pain, fewer lives that are impacted by falls. So super important, and there's real faces on these numbers for me. I can see the faces behind them, and the lives that have been improved. The people that have been able to play with their grandkids. The people that have been able to go to their kids' soccer games because they weren't afraid to walk on the grass anymore, or they could walk from the parking lot to the fields. So important, and really, again, the reason that we do things the way that we do, and we've structured them the way that we have with this organization. And so, if you have any questions, now we can open up the floor. Again, I'll leave this here for just a couple minutes. But if you have any questions, I'll go ahead and unmute the microphones, and we'll take them now.
Good information.
Thank you. Do you have any questions?
I don't think so.
Okay. Well, very good. Let me go ahead and do this. I'll stop the recording. So, before I stop the recording, I'd like to thank everybody for spending the last about 40 minutes of your time watching this presentation. I look forward to hearing from you soon, if only to give me some feedback. Tell me what you think, what you'd like to see. Love to hear from you, and just keep the conversation going. Thank you so much.